What's the most effective type of therapy? Is there a best therapy for substance use and addiction or mental health? Well, in this video, you'll hear from Sarah Fletcher, the Chief Clinical Officer at Sandstone Care, as she walks us through the different types of therapy available and how to choose the right one for your specific needs. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges with substance use, addiction, and mental health conditions. All right, let's get right to it.
Yeah, the best treatment modality for substance use disorders in particular is something called cognitive behavioral therapies, or CBT. And what that entails is really talking and creating a skill set around understanding a precipitating event, so what led up to this behavior, identifying the behavior, which most of the time is using substances, creating dishonesty within the home, and then the consequence of that behavior. And so what is the outcome? And when we create that chain of events, it also loops in that education piece of, okay, so if we choose a different behavior, what is the different outcome that can come from that? And from there, it stems off to create a toolbox of coping skills to be able to guide your mind and your behaviors into an ideal consequence or something that is more pleasurable. So, for example, if the precipitating event is that I snuck out of the house so I could spend time with my friends even though I didn't have approval. The behavior of that is that now I'm with my friends and maybe I'm using marijuana or maybe I'm hanging out after dark or after curfew. And the consequence of that is that I'm grounded now for 2 weeks because I wasn't following the rules and I engaged in a behavior that was from this precipitating event. And so what we look at is, okay, so what was the precipitating event? What brought this on? Was it that I got into an argument with my parents? Was it that I was feeling really lonely? And so we really look at the emotions that come along with that. And then we look at the behavior as a whole and what we got out of it. So what was the positive outcome from this? And then we look at the consequences and, hey, if that consequence wasn't super desirable, let's find a way that we can adjust to make the consequences a more desirable one. And that works and is statistically proven to work well with the early addicted mind because we're able to create new neural pathways in our mind and our brain every day. We're able to create new habits and create new ways to function and cope with what we're struggling with. And it's also a very black and white mentality. It's very easy to understand. It's very easy to pinpoint. And it allows us to really create a plethora of different skills that can help bring peace to what we're struggling with.
So that reminds me of one of the things that I learned about when I got my master's in teaching. Humble brag. When you're working with middle schoolers or like people who are in that middle school range, like 13 years old, apparently their brains are more apt to be able to learn new things. And the only time in which they can learn new things better than that is when they're a baby, like when they're an infant, right? So in that stage of development, that teen, young adult age, our brains are hardwired to be able to learn new things really well. And sometimes that means that we can learn bad things really quickly, but also that we can learn new, helpful, good things really quickly. And so it sounds like one of the things you're saying is, we can teach new ways of thinking, but you have to be intentional about how you are training people to think. Is that right?
Yeah, absolutely. And it also goes into the fact that our brains create new neural pathways every single day. And so what that means is if we think of our brain and all of our neural pathways kind of like a forest, and if we're watering and nurturing those trees, they're going to continue to grow. If we don't nurture and take care of those trees, they're not going to do very well. And eventually they're going to die off. And there may be some deep-seated roots that still remain, but we're not going to see them growing and really flourishing the way that the trees that we're nurturing are. And so that's very, very similar to how building new habits and creating new coping skills works in our brain. The more that we practice them, we talk about them, we understand what works and what doesn't, the more solidified those are going to be. And so it's not that using and struggling with substance use is going to be the same level of cravings, the same level of need forever. And sure, cravings are a very real thing, and they can come up from time to time. And the more that we practice those healthy coping skills and really gain education as to why they're happening and how we can counteract them, that's us nurturing those healthy trees, for a metaphor. So I don't like to put anybody into this is the end all be all. For substance use disorders in particular and addiction, CBT has been statistically proven to have the most positive outcomes. With mental health, we look a lot more at something called DBT, or dialectal behavioral therapy, which is a similar in nature, but it's more designed towards how to get our needs met without the use of manipulation, and how to understand how to communicate with others about what's happening for us in a really healthy and authentic way. And so, again, very similar to a CBT model where we're looking at what happens in our minds, what are the behaviors that are going on for us, and how do we curve those behaviors. With that being said, there's also a ton of research that shows that meeting clients where they're at in their recovery process and staying mindful in the present moment is also really beneficial to recovery and stability with mental health. So it does depend on the person, what that person is particularly struggling with, and the stage of change that they're really in. I would work with a client in a very different way if they were very pre-contemplative in nature. If they were not interested in receiving support, they felt very nervous about the process, and they weren't really interested in the recovery journey. I would use a different model with that client than I would with a client who was, say, in more of an action stage and really was able to practice some skills and had goals and really wanted to practice sobriety and emotional stability. And neither client is right or wrong. It's just it's not a linear process. We go through stages of change, and then big life events happen, and sometimes we take a step back, and that's okay. And the modalities of treatment vary depending on what that person's going through.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number in the description below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.